clearance very, very quickly and easily. And obviously you can see other things to do with the bite and occlusion, which is powerful. And you also find that the patients are a little bit more engaged because they don't really understand an impression. When I first got into dental, it took me a long time to get my head around what an impression was and why it was necessary. We take it for granted every day now, but for a patient it's hard for them to comprehend. They can see it goes that meat, and they understand what they're looking at. So once you're happy with the impression and you know you've got the perfect impression, because it's accurate down to about 8 microns, very accurate, the information then goes to the dental laboratory. If the dental laboratory has the appropriate software, it's a free piece of software. They can actually set the margins. They can set the ditch. They can request additional removable dies, the adjacent teeth, for example. They can request a number of different models. They can do all of this online. As it happens, if you've got a particularly problematic impression and the retraction is proving difficult, you can actually tell the lab where the margin is while the patient's still in the chair. So it's, again, another powerful tool. There's no interpretation in any shape or form. So once the lab has set the margin, the models are actually milled we actually use a HAS machine. HAS machines are, I don't know if anyone watches any custom motorcycle shows. Most of the components are made on HAS machines, and most implant components are made on a machine like this or similar. So it's a precision milling machine that's effectively milling a $25 laboratory model. So they look like this, and I've actually got some here, so I'm going to use the viewer and show you a little bit more in detail. But once that's milled, the removable dies are there, it's sent to the laboratory. So you've got to remember is, although I'm talking about digital technology, we're still producing a very accurate model that any laboratory in the world can use, and that's the key. There is a way of using the data digitally throughout the whole of the workflow, but if you want, this is a really nice way of dipping your toe into digital technology without having to get into too much about teeth design software or dental design software. So I'm just going to switch to this document camera because I've got a model here. And so I don't know if you can see this, but if you look at this portion here, this is a reusable articulator, and the two upper and lower, or upper and lower, get snapped on into place. And because you've recorded the bite and centric, you're effectively telling the lab the occlusion, not the lab interpreting it using an articulator. It opens and closes, obviously, and these dies are removable, so I can take these out. And I'm not sure how well you can see that, but the ditch has been milled on a $250,000 machine, not a kid who's probably hung over earning $20 an hour. So the dies are incredibly accurate, and there's two here. Okay. The other thing it does is the articulator allows you to move backwards and forwards as well, so it allows for that, and you can mount it on another articulator, a Stratos or a Danar or something like that. The other interesting thing about this model is it's made out of a proprietary polyurethane, so it's almost indestructible. I haven't seen one break yet, and I've dropped plenty of them. And this is we call it an expanded model. What I also have here is a quadrant. Okay, and that's actually me. I needed a crown, and from this model, I've got a lava coping in my own head, so I trust the technology that much, and you can see the kind of quality. The other thing that you also have is you can have just an interior. Okay. So because you're taking the bite and centric, you can get away with models that you wouldn't ordinarily necessarily get away with in normal dentistry. So if you want afterwards, sorry for the people that aren't here, but if you want to afterwards, you can come and have a look at these. They're incredible to look at up close, and laboratories absolutely love them. And as I said, they're around $25 to $30, depending on the complexity. So basically covered that slide, so I'll move on. But you know, the interesting thing is that you don't need, it functions as both a working model and a soft tissue model, so you don't need to duplicate a model, which is good. And obviously, because they're milled in such an expensive machine, the machines can mill down to an accuracy of 8 microns. So again, there's that consistency in data, and what you've scanned is what you're going to get back in the model. Excuse me. What you might notice on these particular models is that the information is washed out a little on the opposing. There's good reason for that. It's not because the scanner hasn't scanned it, it's because it's called G-code generation. For the mill to mill the detail on each individual tooth, it would take a couple of days to mill a quality model. So what the software does is wash it out a little bit in the areas it doesn't need. So you get this slight washed out look, and people often mistake that for inaccuracy. It's really not. It's been done on purpose to speed up the milling time. But in and around the preparations and the removable dies, it's extremely accurate. So once the lab gets those models, they can do anything they want with them. They can do a PFM, they can do their lavas, their Emacs CADs, whatever crown that you've requested. The system can also cope very well with bridges. In fact, it'll highlight any undercuts on a bridge prep, so you can actually see that before the patient leaves your practice. Inlays, onlays, veneers, and we're actually getting into implant level models. So I did say I wasn't going to talk about the future, but I'm going to just for a second. This model you see on the screen, sorry about the picture, it was taken, I wasn't allowed to take the picture, but I did anyway. It's taken at one of our research and development laboratories, and I don't know if you can see that very clearly, but it's like the anterior model that I just showed you on the viewer, but it has actually a soft tissue component and an implant or a fixture in there. So we actually can screw on what's called a scan cap. It's like an impression coping specifically for the digital scanner. Scan that, and that then gets translated into the model. So this is the iTero one created on the Haas machine. Core 3D are also working on a solution where we actually rapid prototype the models, and you can see even on this really bad picture, the detail is a little bit better. You can see there's multiple fixtures and removable dies. And there's a piece of software called Model Builder that allows you to really control the design of that model. So we're moving very fast in this field, and certainly implants is the next big thing for this technology. And Core 3D are certainly leading a lot of the research and development in that area. So really excited about that, because it would allow, for example, a specialist perhaps on the review of the implant, so 6 to 8 weeks later when the patient's being reviewed, to quickly scan, and the next time you see that patient, you would have an abutment and a crown ready to effectively put into the patient's mouth, which is a very powerful thing, which we're really excited about. And then, of course, the final restoration is seated. Now, the next slide is a video which I'm going to skip, purely because we've managed to find a way of hooking this up so you can see a live demonstration, or at least a demonstration on a Typodon. So I'm just going to skip this slide and video, if it'll let me.
Filling in the patient's details.
Yeah, okay. So just to review what I've been talking about, what you see on the screen here is the digital workflow. So moving from left to right, you take the scan, okay? The scan is sent to a dental laboratory who sets the margin on a piece of free software. If the lab doesn't have that software, the scan effectively goes to iTero, the company CAD and they interpret it for you. It's an overnight thing. In fact, most of the time it's just done by the computer algorithms that they have on their servers. So it goes to your lab, the margin is set. They can also now take that file and start to work on it digitally using some software, an open architecture laboratory scanner and software called 3Shape. So they can take the file, put it into their own software and start designing your crown. So it's instantaneous. The minute you send it, it appears, and they can start working on it almost immediately. The only problem with that is it's almost too fast, because if they do want the model for QC, they have to wait about 3 days for that to arrive, because it has to be milled and sent. So you take the scan, it gets sent to a laboratory, they can either work on it immediately, or they can wait for the model. So it goes to then two places. The file can go to two places. The first place it goes to is to get the model milled, and the other place it can go is if the lab has designed the crown, is the crown can be milled at exactly the same time. So effectively, you get, as we move to the right of the screen, you get a model and crown back, or at least a coping for a crown back at the same time. The lab then just works on the model as they ordinarily would with the milled restoration, and then they send it to you and it fits into the patient. These things fit extremely well because you've recorded the occlusion yourself. They fit much better. Labs don't have to hedge their bets, if you like, by having slightly heavy contacts because they know how accurate these models are. So you'll find that your seating appointment is much faster, and as I said, most people don't even try in. A lot of people are just cementing them straight in. They just know they're going to fit, and that's incredible to have that consistency, and that's what it's bringing to your practice. So I've mentioned this a couple of times, is this 3Shape lab scanner. There's a couple of different companies that do scanners, but the two main ones if you're looking globally are Dental Wings and 3Shape. 3Shape is a Danish company that designs this desktop scanner that scans stone models, and there's a lot of laboratories around the world that has this. But the lab scanner is really only part of the story. The main part of the puzzle is the software. It's called Dental Designer. And Dental Designer is an extremely it's an amazing piece of software. We've shown it to prosthodontists, dentists, and it really is incredible how fast and accurately you can design a full contour crown or a coping, bridges and inlays and onlays, once you've got that digital data or scan data into the software. We choose to work with 3Shape because we feel it's just that little bit more powerful in terms of what you can do with it, and they're a little bit more ahead of the curve in terms of digital technology. But it's an open system again, so it can take STL files from anywhere and make them work. So not just the iTero system, they'll have their own intraoral scanner called Trios. They also work with some of the lava files from their old lava scanner and a number of others. So it's a really nice scanner, and it's a very nice piece of software. And currently, there's probably in Australia 50 or 60 labs in total that have these scanners. Some of them were sold by us, some of them were sold by other companies because they do sell through multiple channels. And if your dental laboratory has a scanner, whether it's a 3Shape or a Procera scanner or a Strymon scanner, you should really go down and have a look. They're really incredible to watch, and it's amazing to see how complex designs can be done very, very quickly and intuitively. So really, the intraoral scanners are kind of not useless, but certainly they're only part of the puzzle. You really need someone to send it to, whether it's the physical model itself or whether it's a laboratory with the right open scanner that can accept these files. And that's the key, is can your lab accept the files? And this is what it looks like. It's just a small box, just big enough for a model. And that the door closes and it scans. It takes about 5 or 6 minutes to scan a model. But of course, if you've already scanned the patient with an intraoral scanner, the data's already ready to go, which is kind of nice. So just another thing is CAD is a company. They're actually originally an Israeli company. I suspect there's some American spy satellite technology in the one there. But the company is an Israeli company, but their head offices were in New Jersey. They were actually recently bought last year by Align Technologies, which is effectively Invisalign, for $195 million. The reason Invisalign like it so much is because one of the biggest roadblocks for doctors and orthodontists doing more cases is the impression. It needs a particular type of impression, and it needs to be a very consistent impression. And a lot of this time is spent by the practice development managers in not teaching people how to do impressions. It's probably the wrong word, but certainly re-familiarizing them with the specifications that Invisalign require, let's just say. So because that's a big roadblock, Invisalign looked to this technology to help them. So what can happen now is you can scan a full arch. It's a slightly different scanning sequence. It takes about 10 minutes. And the scan is then sent directly to Invisalign. And I'm not sure how many people are familiar with it, but there's something called a ClinCheck. There's some operators or technicians that align the teeth, the virtual teeth, and then send it back to the doctor for approval. That now happens in under 48 hours. So from the day you've scanned the patient, 48 hours later you'll have the teeth aligned for you to check and sign off. If you sign it off immediately, if the technician has done the job right and it's ready to go, you press OK. And the fastest turnaround time we've had for Invisalign is 9 days. So from the day the patient came in and was scanned to when the aligners arrived through the door was 9 days. So you can see why Invisalign really like this technology and they invested so heavily in it. So I'm talking to Invisalign pretty much every other day right now because orthodontists have really embraced this technology, as have a lot of the other general practitioner providers of Invisalign. And it's kind of nice. I've been in sales a long time, too long. And it's very rare. In fact, I don't think I've ever had someone phone up and say, thanks, it's changed my practice. Because a lot of the stuff you sell and a lot of the products you either need or you want, this is a real game changer for a lot of practices. It's especially orthodontically. They get so enthusiastic about it, and it really does improve and streamline their workflow. So that's the Invisalign angle. Just interestingly, right now, I'm not sure whether it's the same in every state, but the technology is a little bit of a grey area in terms of what it is. It's not really an impression. It's classed as a photograph, which means that auxiliary staff can take the photographs, which is interesting and obviously very popular among orthodontists. It's not just iTero. I've been talking about iTero mainly, but Heraeus, again, as a global organization, have invested in a similar technology called Trios. Their ecosystem, if you like, is called Cara. It's very nice. And they're partnering with 3Shape and Core 3D here in Australia to, we'll be installing and training the Trios system. The data will be sent to our channel partners with the 3Shape scanner. They'll design the restoration, and then we'll actually mill it at our facility in Sydney, and then it'll be sent back out. So you'll be hearing a lot about Core 3D just by default, because a lot of companies are looking to us as a global manufacturer to access countries very, very quickly. So, you know, if you do see anyone from Heraeus, certainly ask them about it, or certainly Google it. It's called Cara. And the scanner itself is very nice. It uses a parallel confocal technology. It looks a little bit different. It looks more like an impression gun. And it's got a touch screen, and it looks very space age. It has its positives and negatives. I've yet to really use one in anger, and I'm looking forward to using it. But whether it's the iTero, whether it's the Trios, whether it's something else down the line, this technology is here, and it's here to stay. So it's definitely worth starting to ask the right questions now rather than later. So just to review a couple of things before we move on to the other things that the scanner can do and give you a demonstration is that, you know, mainly the communication between the dental laboratory, the noise, let's say, between the dental laboratory and the practice almost goes away. They get the right information because you have to fill it in on the RX. The information you're giving them is more accurate, 8 microns accurate, and they don't have to articulate. You've effectively given the articulation information for the models. Patients are much more engaged. They're really blown away by this technology, especially if they've had conventional impressions in the past. They don't like it. I don't like it. I'm sure no one in this room likes to have an impression. It's quite a traumatic experience, and I don't gag, but it took all my effort not to, and it's just horrible. It's very invasive. I find the auxiliary staff pick up the technology much faster than the dentist. I think it's just probably a generational thing, but also the wand has been designed for a single operator. You don't need to retract. You don't need to use too much. You need retraction around the the preps, of course, if they're subgingival preparations. But you don't need to retract the teeth and things. It's designed for one-handed or one-operator use, so you can actually get a lot more people involved, and it kind of reinvigorates your practice a little bit.